Hey,
What's
doctor.
up?
How are you?
I'm good. How are you? We'll
Tired.
let people kind of trickle in for a minute.
Yep.
And then we'll get started. So, for everybody that's hopping in, I posted this, just an opportunity for you guys to hear, questions from, a patient's perspective. Like we've walked through the whole journey of, from her pre-op through surgery. Now this is just post-operatively, like in reflection, not only just talking about, what she's been through, but also questions that she's gotten from people, and, questions that you guys will have as well. So I get a lot of questions about fibroids. I get people calling me. I get people DMing me. This is actual dialogue. So please take advantage of it and just, post your comments at the bottom, and I'll try to get to as many questions as I possibly can. So take the floor, introduce yourself, and go right ahead, man. It's your show.
Hey, everybody. So for those of you who don't know who I am, I'm Cola Red Bell. For those who know my journey, basically I had a hysterectomy to treat my fibroids approximately 6 weeks ago. Dr. P performed my surgery, and I am feeling and doing wonderful during my healing process. So I definitely wanted to be able to give you all the opportunity. I get a lot of questions. I get a lot of support. I get a lot of women sharing their journey with me now that I went public with my journey. So people submit questions all the time. So we both thought it would be a good idea if you were able to have a virtual doctor's visit with me and be able to have a chance to answer some of your questions as well. So I have some that were submitted already. And then, like I said, Dr. Johnson said, try to put them in the comment box. We'll try to get to what we can in a certain amount of time. But he was gracious enough to agree to do this. So we do appreciate you, Dr. P.
My pleasure. And so she was a little modest about it. Like she came to me and has had fibroid issues for years. And she was like, look, I'm apprehensive, I'm nervous, and trusted me to take care of her. And I have to be honest, she has had past tense, had one of the larger fibroids, and uterus that I've seen. I would say at least top 10 that I've seen in my career. So it was 5 pounds, 7 ounces. And, she was told by everybody that she would need to have an open surgery or, a vertical incision to remove these things. So I performed it with very small incisions, and was able to, she got out of the hospital in 24 hours, recovered, and was, doing well, within 2 weeks. So it's possible. And I wanted to show you guys. And if you didn't see the whole journey, if you look at my page, it'll have like her pre-op, surgery, everything, through our whole journey. If you guys want to check it out. But this is it. This is post-op, and this is, us asking a question. So go ahead, shoot the first question, and I will answer them.
All right. So question number 1. So in my procedure, I elected to have a full total hysterectomy. So now that I no longer have a cervix or a uterus, what do you use a gynecologist for in that type of situation?
Perfect. So just a little bit, like I've done a post on this before, as far as terminology, right? So when you hear like a not misinformation, but bad terminology that's out, in the public is full hysterectomy, partial hysterectomy, complete. Well, not even full. It's complete and partial hysterectomy. And these terms are adequate. They are adequate, but what they actually are is misconceived, right? So A hysterectomy is just a hysterectomy. So if you remove the uterus, it is a complete hysterectomy, meaning that you take the uterus and the cervix. A subtotal hysterectomy is just taking the uterus without the cervix, right? So if you leave the cervix, you keep the, and you take the uterus out, that's a subtotal hysterectomy. So hysterectomy, hyster meaning uterus, just means removing the uterus. Now, people get that confused with the ovaries. So the ovaries are different. So if somebody says, I got a complete hysterectomy, it's not that you got your uterus and your ovaries removed. It's that you have your uterus removed. Your ovaries are separate. So if someone says, I had a complete hysterectomy, they had their uterus, but they have to add, if they're getting their ovaries removed, still can be done at the same time, but it is separate from the actual hysterectomy. But in answer to the question, which is an excellent question, is this. So if a woman has had a hysterectomy, why does she need to go to the gynecologist? And the reason that she needs to go, she doesn't necessarily, I'll take that back. She doesn't necessarily need to go to a gynecologist. She does need to have an annual exam. And the reason why she needs to have an annual exam is because you have breast, you have a heart, you have lungs, you have kidneys, right? So at your annual exam, a doctor is checking all of these things. They should not just be checking your cervix. Like, that's all a pap smear does. A pap smear is just checking the cells of the cervix, right? But if you remove the uterus and the cervix, you still have ovaries that are there. So in her case, the ovaries that are there, like, I should be, or a gynecologist should be, doing a bimanual exam, meaning that you should feel for the ovaries to make sure there are no masses, there are no issues with the ovaries. Should also be doing a breast exam, right? And not only just doing a breast exam after the age of 40, should be getting a mammogram every year. Somebody should be listening to your heart. Somebody should be listening to your lungs. Somebody should be feeling your thyroid glands. Somebody should be listening to the vessels that are going up your neck, that are your arteries going to your brain, which are, a big thing that can happen with strokes and clots and those types of things. You can get those and hear those things early. There are labs that should be drawn, right? So when you're 40, you should have thyroid labs drawn. You should have a CBC, a CMP. You should have a lipid panel. You should have looking at a fasting glucose to checking for early diabetes, checking for your blood pressure. So all of these things are done at the annual exam. So though she does not have a uterus, all these other parts that could go wrong in her body. We talking depression, anxiety, what's going on in your life? Like, a doctor should be talking to you about all of these things. And all of these things don't just go away or don't have problems once the uterus goes.
All right. Are there pros and cons to leaving the cervix when having a hysterectomy? In our case, we chose to take both.
Correct. So the answer to that, in short, is no. There's no true benefit of your cervix. There's a misconception that leaving the cervix will make sex better. Well, you won't lose your sensation if you remove the cervix. If you keep the cervix. That's false, right? It's been studied extensively as far as removing cervix or keeping the cervix. Sexual satisfaction, pleasure, erogenous zones, and those things, it does not change, right? So every patient that I've had that has had a hysterectomy with removal of the cervix, I have not had one complain that now sex is painful or sex is not enjoyable. Like, so keeping the cervix for sexual pleasure is not necessary, and also keeping the cervix for pelvic floor support. People think that, well, if you take the cervix, what's holding everything up? Everything will fall down. That's not true either. Removing the cervix or keeping the cervix does not increase the risk or decrease the risk of pelvic organ prolapses, which things actually start to fall in the vagina. So the only time that I keep the cervix, there is one time where I keep the cervix. So when people actually, when people do have pelvic organ prolapse, I do a procedure called a sacrocolpopexy, in which I'll keep the cervix there and I attach a mesh to the cervix and pull it up and attach it to the sacrum. That's a whole different conversation. But for somebody that just is looking for a hysterectomy and needs a hysterectomy, you not have to keep the cervix. If you do keep your cervix, now you're obligated to have pap smears, right? Because you need to have someone checking your cervix now. If you don't have a cervix and you've never had abnormal pap smears in the past, you never need a pap smear again if you get a hysterectomy with removal of your cervix. If you keep your cervix for whatever reason that you want to do that, now you still fall in the line of anybody else that can get a cervical cancer, even though you don't have a uterus. Here, I'm gonna answer one of these, and I'm gonna let you get back to yours. So, can you recommend great doctors like you, African American? What? Yes. So African American doctors, we're all over here. Like it's, if you looked at, COVID or what have you, like I even learned about all these doctors that are out here. Utilize your social media to your advantage. This is how she found me, through social media, just me running my mouth and teaching. So they're out here. They're specialists pretty much in everything from cardiologists to, generalized surgeons to plastic surgeons to fertility doctors. They're all on social media, and we just have to use that as a resource, right? So I have a network of Black doctors. Every Black doctor has a network of Black doctors. So if you want to find one, don't be afraid to, go into their DM and ask them, like, do you have a recommendation in this particular area, what have you? We have to utilize the resources that we have. All right, go ahead. What's the next question?
Well, there's one in the comments. Can men tell during sex if a woman has had a hysterectomy?
Absolutely not. No, they can't. Unless they're gynecologists like me. They have absolutely no idea. The only thing that you can really feel after a hysterectomy is if there is a cervix or there's not a cervix there. But men, honestly, 99% of men don't really know whether the cervix is there or not. If it's wet, it's warm, they're happy, period. But they're not going to be like, oh, did you have a hysterectomy? Like they're not going to do that. So it's not a thing.
All right. Next up, so do women past menopause need a gynecologist even when Medicare will not pay for the pap smear?
Yes, they don't necessarily need a gynecologist. So menopausal age, official menopausal, not official, but the average age of menopause is 51 years, 4 months, right? In the United States. Menopause is defined as 12 consecutive months of no period of age with, ovarian failure without any medications that are causing you to stop having your period, meaning you're not on birth control, you don't have any medical conditions or anything like that. You just stop having periods. That's what menopause is. With that being said, Medicare will continue to pay for annual exams, right? The annual exam can be performed by a gynecologist or a general practitioner, right? It can do both. The age to stop having pap smears is 65. So if you had all normal pap smears, never had an abnormal pap smears, stopping pap smears starts at 65. The age to stop having mammograms or checking your breast or screening mammograms is age 70, right? That doesn't mean that you just die at 65 or you die at 70, right? You still need, even though you don't need a pap smear, you still need someone checking to make sure that you don't have masses on your uterus, masses on your ovaries, because you still can develop cancers, right? So 1 in 9 women are going to have ovarian cancer in their lifetime. How do you detect an early ovarian cancer? At annual exams by doing a bimanual exam and feeling the ovaries. So I have patients that are 75 plus. I'm still doing bimanual exams to make sure that their ovaries okay. And even though they're not getting mammograms, I'm still doing breast exams to make sure that they don't have lumps in their breasts. Just because you're not doing mammograms anymore doesn't mean a 75, 76-year-old woman can't develop breast cancer. They're just not screening rigorously like that anymore. But you definitely need annual exams, right? And that's not true as far as what Medicare or your insurance will pay for. They may not, well, even with pap smears, I don't even think they cut off with the guidelines like that, but they're paying for annual exams, and annual exams are part of, or pap smears are part of annual exams. So I've never seen someone's, a denial of elderly patient that got a pap smear and just says, just no, it doesn't happen. Get your annual exams no matter the age.
All right. So how is ovarian cancer screened for? Is there a special procedure, or is it just a feel?
So there's really no true way to, you don't necessarily start to just put out labs and tests for ovarian cancer. Now, it's important also during your annual exam that your doctor is asking you about your family history. Like, I just had a conversation with a patient that has not only a strong family history of breast and ovarian cancer, she has a family member that was diagnosed with the BRCA gene, meaning that family, all the women have a 40 to 60% chance of developing breast cancer in this lifetime. Another 20 to 40% chance of developing ovarian cancer in this lifetime. So with that being said, their screening is going to be different, right? It's recommended for them to get prophylactic or removal of their ovaries, removal of their breast once they're done having children, because their risk of cancers are so high. But as far as everyone else, that's why the annual exam is so important. The very first thing that you can start to experience is pain. And as everybody knows, women have pain on a regular, like pain just happens. So you to actually know if that's a pain that you need to really be worried about versus a pain that's, may not need to be worried about, then annual exam and a bimanual exam is extremely important. You don't start running labs, but you do need to get a pelvic exam to make sure that your ovaries okay, because I've diagnosed multitudes of cancers just by doing bimanual exams. There's pain there. Now I send you for ultrasound, and now there's a mass there. Right? That's early detection is the key.
All right. So we got a question in the comments. Can you request a uterus implant? And they said requirements, so I'm assuming that means, and what would be the requirements? I'm not sure.
Can you request so have they performed a successful uterine transplant? Yes, but it is still pretty much in the experimental phases, right? Like, one, it is extremely expensive, right? Because there are not many doctors that are doing it, because it's hasn't been successfully done, except for a handful of times. I know one for sure, but it's no more than like 5 or 10 that have been successfully done. So it's still in its experimental phase. Yeah, if you really wanted to get into and try your uterus, you had a big issue with your uterus, and that's something that you wanted to do. The few centers that are actually doing it, yeah, you can actually do it, but I'm sure that it is ridiculously costly.
All right. Have you heard about the breast screening HER-Scan? And if so, do you have an opinion about it?
The breast screening HER-Scan?
Yeah, it's like an ultrasound, and I think that it's not really covered by most insurance. It's like an ultrasound for breast. It's like an alternative to mammogram because they don't do the radiation, from what I read about it.
And the question would that be recommended?
It was just, what was your opinion about it? Or did you have an opinion?
My opinion is that there's not enough information on it. My opinion would be, even though mammograms are uncomfortable, they are life-saving, right? So I would definitely, until there is a new guideline that says, this HER-Scan is, even more accurate than a mammogram, that you get your mammograms at age 40, especially for African-American women. Just get it, just like, for men, like, is it, to have some of these colon cancer screenings where you don't have to get a colonoscopy, you just go into a cup and send it off. Like, Can they detect their early colon cancer? Yeah, they can, but they're nowhere near as accurate as getting a colonoscopy. So with that being said, you know, I have a family history of colon cancer, so I wasn't playing with that. I wasn't going, doing something that I know is not as accurate as something that I do know. So that would be, things may look or sound, better or interesting, but don't go against guidelines. That's my advice to you.
All right. And then you kind of touched on this already, but the last question was, is there any way to specifically find Black doctors, like a universal database for them?
Yeah, so it's really not a universal database. There's it's blackdoctors.org. You got different websites that have Black doctors that participate regularly and actively. But my biggest thing would be utilize social media. Like, social media is a great place. Any Black doctor that you see has a network of Black doctors, especially ones that went to HBCUs that have a multitude of Black doctors that they know. Don't be afraid to reach out to them. Usually they are very approachable, and will, and they're not like celebrities where they have millions of inboxes where they can actually get to, your question or concern. We for the most part, everybody is in here to try to, Black doctors are got into it to help people. So you should not run into, a jerk or a-hole. Not to say they don't exist, but for the most part, they're extremely approachable. So if you reach out to them, they should help you or point you into the direction. There's somebody that can help you.
All right, I did get another one. How long is light bleeding after a hysterectomy? How long should you expect to bleed?
So you should expect it varies from person to person. Usually it happens for 2 weeks or so. Sometimes it's a little bit more, sometimes it's a little bit less. So you have to look at it like this. When you do a hysterectomy, you basically are cutting a hole around the cervix, which is attached to the vagina, and you're pulling everything through that hole. So that hole at the end of the day has to be sutured up. And it, just like anything, it scabs. So just like if you went and fell outside and bumped your arm, and had a scab on there, if you rubbed it up against something or you did anything, it'll start to bleed. Kind of similar concept. Like, you have healing tissue at the top of the vagina. It's called the vaginal cuff. That can get irritated, and that can cause some bleeding, right? And if that bleeding is not bad, you should never be profusely bleeding, but as long as that cuff is healing, it can give off a small amount of bleeding. Everybody heals differently. Some people heal, very quickly, and I've had patients that had no bleeding at all. And I've had patients that have had significant bleeding, for a few weeks. Not as much to have to change a pad or anything like that. If we got to change pads, then that means that something is wrong, that there's a artery or something that's pumping and maybe bleeding that needs to be investigated. But other than that, you can get a small amount of bleeding, and that's not uncommon. It's very common for that to happen.
All right. Did you really take out all her fibroids from those little bitty holes on her stomach?
No, I did not. I took out all of those fibroids and everything through her vagina, right? And the amount of elbow grease and tugging and pulling is probably,
and battle scars.
And battle scars. It was a fight. It was me fighting her fibroid to come out of her vagina. It was a fight. So if you actually saw it, it was only a few people that's in the room that actually witnessed this, but it was literally like a heavyweight fight, like Tyson Fury and this whole fight that this happened this past weekend. I had nothing with me trying to pull these fibroids out of vagina. We literally talking about I think the biggest one was 17 centimeters or 18 centimeters, something really big. So it literally was something like this size, like pulling that out of her vagina. So getting that out was very difficult, but I struggled, so she didn't have to struggle. So I made that struggle. It probably took me about an hour and a half to get all of that out of her vagina. But with that being said, she's out of the hospital in 24 hours and back to her normal life. Less than 2 weeks, we say. So it was worth the fight for me.
Well, I don't know about 2 weeks, but
all right, well,
I felt good in 2 weeks.
So
but
are you able to do your normal stuff?
It's just the fatigue, and I don't know if that's because anesthesia but you are like tired. You feel like your body went through a change, or I don't know how to describe it, but it's like you are more tired. So I would notice personally around 12 or 1 o'clock, I would get extremely fatigued, and it would be like on a regular basis. So
in your situation, it's a little bit different because what we don't talk about is that you lost like 3 liters of blood, right? So your case is extreme, right? It usually doesn't happen that way. So you literally lost an entire person out of your body. So your body had to adjust to that. Usually it's not that extreme, but for you, yes, it's a little bit differently. But I just want people to say, when I say that, like, you can walk, you can do your, pretty much your normal routine as far as, you may feel a little bit drained or what have you, but there's no restrictions as far as the things that, you can normally do. It may take you a little bit longer to do them, but you should be able to do, your normal activities in about 2 weeks or less.
Yes. I agree with that 100%. I feel like I was able to do everything. So we got a question in the comments. What are the chances fibroids return after treatment?
Great question.
Which treatment?
Great question. So we'll break that down. So with an actual hysterectomy or removing the uterus, the chances of fibroids coming back are 0, right? Fibroids grow on your uterus. If there is no uterus there, then fibroids have nothing to come back on. As far as fibroid surgery, right? So actually removing the fibroids, and this is where it gets a little bit dicey and where people kind of misunderstand this concept. A lot of doctors are, performing laparoscopic myomectomies, which I've done, for a large portion of my career. But the problem with laparoscopic myomectomies is if you don't get everything, then you have a higher likelihood of fibroids returning. And the problem with like ultrasounds and imaging for fibroids is usually the big ones are red. Like when a radiologist like reads it, they'll read like the biggest one. So like my typical thing I'll have when I do a myomectomy on somebody is they'll say, patient has 4 fibroids, or list the fibroids out. I go in there, I remove the fibroids, and I remove like 25 of them, right? Because they're not going to mention the ones that are fingernail size or half a fingernail size. So when you leave those back, the likelihood that those can grow are much, much, much higher. And the likelihood that you leave those are much, much, much higher if you do a laparoscopic surgery where you can only see and you can't feel the uterus. So now, unless I can confirm a patient has like 1, 2, or 3 fibroids that I can see that are large, unless I can confirm that, which is rare when I can, I now perform open myomectomies. But I focus the surgery to make this incision as small as I possibly can and as low as I possibly can, so that recovery time is quicker. But when you get all of the fibroid material, the chances of the fibroids actually returning and getting larger, it's much, much smaller. So my success rate with my new technique, open myomectomies, is much higher as far as recurrence of fibroids than my laparoscopic technique.
All right. Are ovarian cysts an early indicator of fibroids?
No, big difference. So every woman that is of reproductive age, from the time you have your first period and the time you have your last period, you have eggs. Those eggs one lucky egg every single month, except for when you get closer to menopause, will get mature enough to where it ruptures. That will formulate into a cyst. So a big misconception is that ovarian cysts are not normal. Ovarian cysts are very normal. They're a physiologic process and normal way of life for women. The only way you can really stop ovarian cysts from forming is birth control or suppressing the ovaries. Now, those are physiologic cysts on your ovaries, but there are pathologic cysts on your ovaries that are bad. So like hemorrhagic cysts, dermoid cysts, there are different cysts that are not part of ovulation that can grow on the ovary that are not good and possibly may need surgery or what have you. Nonetheless, whether it's a physiologic cyst or it's a pathologic cyst, these cysts they have minimal correlation with fibroids, right? So if you see a woman with ovarian cysts, I've had patients with all type of ovarian cysts and needed surgery for ovarian cysts and had absolutely no fibroids. So it's really not an indicator. Like you're talking uterus and ovaries, two totally different organs. They are intimately related, but as far as fibroids are concerned, not so much. It's not a huge link between the two.
All right. What age did you know you wanted to be a physician? 5 years old.
When I was 5 years old, I knew I wanted to be an OBGYN. I'm weird. I'm kind of weird. Like when I get my mind set to do something, like there's nothing going to stop me from doing it. So, as a kid, I was challenged by my aunt to, get a plan B other than playing basketball or baseball. And I was just like, well, all right, I'll be a doctor. Why did I say that? Because I saw the Cosby Show as a kid. Cosby Show was like, that was the only real positive black male role model in my life other than my granddad. But this was, somebody was a family man, took care of people, ate hoagies, was just chilling, funny. Like as a 5-year-old kid, I was like, I'll do that, right? And little did I know, it was like I thought that was not only interesting, it implanted a seed in my brain. So that was like something I said. Like when I was 5 years old, I was like, I'm gonna play professional basketball, but I'm going to be a doctor too. I said that, and I literally, over the years, after I kept saying it, I was like, that's exactly what I want to do. And when I was 9, my mom was pregnant with my brother, and I was fascinated by childbirth, and that's it. I knew exactly what I wanted to do since I was, 5 years old, and really cemented it when I was like 9 years old.
Yeah, so many people may not know because, I researched the hell out of you, that you wrote a book.
I did. It's all in
And if they really want to know your story, they can read it too. My mom even said that had I let her read your book before my surgery, she wouldn't have threatened to show up at your job. And if you hurt her baby.
She did. She called me and was like,
so I let her borrow it and she read it and she loved it. So where can people get your book? I mean, I got mine off Amazon, but do you have a preferred way?
Amazon. Amazon is the best way. We've been really blessed with the book, because we fund a scholarship every month from our book. So that's a little known fact. Like we don't pocket $1 from that book. We wrote it in 2018, and every single dollar has went for scholarship. So we give $1,000 a month that is completely funded off of people buying the book. So it's on Amazon. We also, our website, www.pulsap3, like your Pulse of P3. It also has like the scholarship information. It has all of our scholarship winners. If you go to Pulse of P3 on Instagram, it shows like every one of our scholarship winners. We highlight Black excellence. We show like the world that, Black kids are out here doing positive things instead of, the garbage that we see on TV, and just kind of show that, the narrative of how society looks at our kids needs to change. So we do our part by not only giving them money, but also giving them a platform so that they can speak and show what they're doing in their communities.
That's amazing. We got another question in the comments. Can women conceive after menopause?
No, they cannot. So after official menopause, meaning 12 months of no periods, I'm not, I can't say absolutely not. There's nothing absolute. As long as you have a uterus, there may be some way, shape, or form you may ovulate after menopause one time, and that one time you may have sex that week, and a woman can get pregnant. It can happen. Just like women that don't have regular periods but can still get pregnant. Like, so it can happen. It is highly unlikely. If you have a menopausal woman that gets pregnant, it's most likely a Jesus child. It just it's not something that will happen. That's not in the Guinness book.
All right. So I don't have any more questions sent to me. Does anybody else that's watching have questions they want to drop in the comment box? Because I know Dr. P on call. He got to get back to work.
It's cool. I ain't studying these folks. But yeah, thanks everybody for tuning in. Like, I will, I want to continue doing this. So if you guys like this, and this is helpful, I think this should be helpful for, most people. I'm going to continue doing this because I could talk all day long. I talk about, I make stuff funny. I talk about other education. It's all to get you guys to learn and to understand. It's not just women's health. It's health in general for our people. But I think that it's better received when you actually have a woman that's been through it. So I'm going to start to have my patients that are going through things, been through surgeries and other things, to start doing lives with them so we can have, open conversation about not only their experiences, but like stuff that you guys want to know from them and from me, to just, maximize the educational opportunity.
All right.
Cool.
We did get a question. So I'm 4'11", 127 pounds with fibroids. My stomach seems to be bloated and hard. I know that feeling. Should I be concerned?
Yes, absolutely. You should be concerned. Don't sleep on that, because, and I will say this, and I don't say this story to scare anybody. But I tell a story because I have experience, and I think that life's experiences are should be utilized for a reason. And to that end, uterine sarcomas, right, which are actually cancers of fibroids, are extremely rare. Extremely rare. I mean, like one in, I want to say, close to 10,000. I mean, they are really, really rare, and they are even more rare the younger a woman gets. So I had a patient several years ago. She was 33 years old and came to me kind of similar, found me in the town that I was in. It was just like, never had babies. I have these fibroids, and, I want to preserve my uterus. And like her fibroids were like similar, like extremely large or what have you. And at that time, I was like, okay, well, I'm going to do an open myomectomy, preserve her uterus. But lo and behold, when I went in there, I mean, it was just utter mess. I mean, it was like fibroids had completely ravaged her uterus, and it completely obliterated her cervix. Now that's odd. Like, it usually fibroids don't make it so that the cervix is completely destroyed. So I tried to piece stuff together and look at it because I was like just dreading taking this woman's uterus out because she hadn't had any babies, and I promised her that I was going to do everything to preserve her uterus. Well, it was a reason why when things are abnormally abnormal, there's usually something wrong. So I performed a hysterectomy. I had to remove her uterus because there was absolutely no preserving her uterus as is, because she had no cervix. Everything was done. And so when I did it, I sent it off to pathology. I didn't think nothing else of it. I had a long conversation with her after. I told her I was sorry, but I didn't have anything else to do. And it came back as a sarcoma. So she had young Black girl, 33 years old, that had a uterine sarcoma. And from that course on, she had a very hard course. Ended up passing away about 3 or 4 years after I performed that surgery. But I say that to say that as much as I can sit up here and tell you that, yeah, fibroids are benign, they are benign, meaning that they're not cancerous, but rarely they are. So if you have, a uterus that you can feel and you're pressing on it and it's hard and you don't feel right, don't sit on that. Don't run from it. Cola Red was able to, dodge a bullet and came back with these big fibroids, and they were completely benign. Thank God, bless the Lord. But that's not going to be everybody's story. So if you know it's something there, you know that you need to, to do something about it. Don't run from it. Right? It's people out there. I'm not the only person out here that actually cares. There are people that actually care, and will take the time with you, listen to you, take all your concerns, and handle you with care. You just have to find them. If it's not me, it'll be somebody else. Like one of my brothers that wrote the book with me also does these surgeries as well. He's in Louisiana. Like, there are people out here that do that. So if you have that, don't think that everybody's going to try to take your uterus, even though hysterectomies are optional if that's something that you want. But there are people that will preserve your uterus for you if that's really what you want. But if you let these fibroids get, to the point of, no return, anything can happen. So don't sleep on stuff. Like take control of your health, take control of, everything that's going on with you, and find somebody that's going to listen to you and take care of you appropriately.
And one of the things I can honestly say I appreciated hearing you say is that just because you avoid it doesn't make it go away. So I took a long time out of fear to address my personal issue with fibroids, or as the woman commented, I would feel them. I would have the heavy bleeding every month. I would adjust my life around it, but none of that really made it go away. And you told me we were like this close from I wasn't going to be able to get laparoscopic. So, I still had to do research and I still had to get comfortable. I don't think that I should have skipped any of those steps, but it didn't make it go away, me sitting on them growing for 5 or 6 years. They just kept getting bigger and bigger and bigger. So, and they were very uncomfortable. Like he said, my uterus has stretched to the size of an 8-month pregnancy.
And please, people, for Jesus' sake, don't put that pressure on me. like, you know what I mean? Like I was able to get it out, but I promise you, like there was some times in there it was like, you done stuck your big ass foot in your mouth, and you're gonna have to cut this girl open. You ain't gonna be able to do it. Like literally, if her fibroid was another centimeter, if it was this much bigger, I wouldn't have been able to do it. Because when you do laparoscopic surgery, you have to stick the ports in. So the ports are just like cylindrical pieces where you put them in the belly so that you can actually put instruments in. And the instruments are really like long sticks with things on the end of them. And when I stuck my ports into her belly as high as I could possibly go without going into her lungs, I stuck the instruments in, and literally I had this much room between the top of her fibroid and my instruments. If I can't move my instruments, I can't do anything. So she was that close for me not being able to do this. And even with that being said, I had to get all of this stuff out. So I did it. I'm happy I did it. She's happy I did it.
I'm happy you did it.
don't put that stress on yourself, because I promise you, and I'm not even trying to toot my own horn, but I promise you, if you had 100 gynecologists, 1 or 2 of them was going to do what I did, because it's that difficult to do. You don't want to put that type of stress on your gynecologist, but nonetheless, it can be done. So don't let anybody tell you that it can't be done either. But you want to have as easy of a surgery as you possibly can. And so another question was, should a woman with heavy bleeding take daily iron supplements? I say yes. The short answer is yes. But more importantly, a woman with heavy bleeding should find out why she's having heavy bleeding, right? So this is a little known fact. So it takes 3 months, 3 full months for your body to produce a new blood cell, right? So let's say it's just like putting gas in a car, right? If I fill up my tank of gas and then I drive all of the gas out and I expect the car to keep going before I could put more gas in it, it's not going to work. So if you're taking supplements and it takes your body 3 months, but every month you're bleeding extensively, it's going to catch up. It's not your body can't. Well, rather your body won't be able to catch up. You're going to be anemic, and the problem with anemia is when you have severe anemia, um, you can't like your blood carries oxygen to all your tissues, right? So when you breathe, the blood is carrying not only oxygen to your arms, your legs, your heart, your lungs, your liver, all that stuff, but it's also carrying it to your brain. So if you have super thin blood and you're trying to get oxygen to your brain, right? You can deduce what's going to happen. That's why you start to get blurry vision. That's why you start to get dizzy. That's why you start getting shorter breath. You get shorter breath because that's your body's physiologic response to anemia, right? You're breathing heavier because you're trying to get more oxygen in because there's a lack of oxygen in your body. So that's why you're breathing heavy. All of these signs and symptoms are severe anemia. Worst case scenario, right? Why is that bad? You walking around the house, you start to feel lightheaded, dizzy, you haven't eaten in a day, you're super anemic, you fall, you hit your head on the sink. Nobody's there to come to help you, right? You start bleeding out on there, you're unconscious. Nobody gets you for an hour, 2 hours. You can die right there from anemia, right? You driving your kids to school, you get dizzy, blurry vision, you pass out, you faint, you run into something, into ongoing traffic head on, right? Yourself, your kids. That's how anemia can kill you. So you don't want to play around with anemia like that, because it can be very bad. I have patients that come in here that have been fighting surgeries and not doing it, whatever, with hemoglobins of like 3. Like you can die. Like there is a finite amount of blood in your system, right? So it's not like you have, you know, a sea of blood. You have also many quarts of blood in your system. So when you run out completely and you're trying to oxygenate your body and do all of these things with this little bit of blood, it's like trying to have like one bottle of wine and try to like, get a whole party drunk. You can't do it. Like you got to have enough to be able to feed all your tissues. So don't play around with anemia. Those are my analogies for it. But all kidding aside, like you got to take that really, really seriously.
All right. Are uterine polyps as serious as uterine fibroids?
No. So endometrial polyps. Are they're benign growths of tissue that are in the endometrium, which is the lining of the uterus, and they typically will cause you to have abnormal bleeding, right? So you can have abnormal bleeding from those polyps. They are not usually as serious as uterine fibroids. Notice I said usually, because if you have a polyp, you can have a small polyp in your uterus that's causing you to bleed extensively and causing you to be anemic, but you don't have fibroid. That can kill you just as quick as somebody with large fibroids that's just having a little bit of pain but having normal periods. So it really depends on the situation. In short, I would say no, but yes, it can be if it's causing you to have severe symptoms and severe bleeding. Absolutely, it can be.
All right. What's your preferred treatment option for women with symptomatic fibroids? UAE, myomectomy, accessa, or hysterectomy?
So I'm gonna tell y'all this again. I've said this multitudes of times. I don't care who doesn't like it. We can argue about it all day. I am a fibroid guru because this is what I've niched myself into doing. I despise UFEs. I don't like them. I feel they're physiologically just not a good procedure, right? They are an attractive option because they're minimally invasive. You can treat fibroids and not big surgeries or what have you. But uterine fibroid embolizations, in my experience, which is very extensive, don't work very well. I promise you, I just did a telehealth visit before I got on this live with a patient that had UFEs and is coming to me to get a hysterectomy. I can give you a multitude of patients that have had UFEs that now they can't get accessa, right? They can get myomectomies, but they can't get accessa. They don't have many options, right? UFEs are going to cause ischemia, which cuts off oxygen to your fibroids. It's painful and it doesn't work extremely well, right? So as far as the difference between myomectomy, excessa, hysterectomy, those things, right? There is no correct answer to it. It all depends on what you want, right? It depends on what you want. So for a woman that is, 39, 40 years old, hasn't been pregnant, wants to have a baby extremely bad, and wants to do what she can to have a baby, hysterectomy doesn't make sense for her. So it's not my decision to tell her that a hysterectomy is good for her. Like, it really depends on what she wants. So between myomectomies and an excessa, it really depends on the size of the fibroid. It really depends on the location of the fibroid. All right. So if the fibroid is actually pushing into the cavity of the uterus, which is called a submucosal fibroid, and she's at the end of her road as far as getting pregnant, meaning like 40, 41, got not so good egg quality and really need to get pregnant within the next year or two, we can't play around with things that are not going to get rid of things quickly, right? So I love Excessa. I go around the country teaching Excessa to physicians all over the country who follow my page. But I'm not going to say a woman that's 41 years old that is really, really, really trying to get pregnant soon and trying to optimize her chances and has a submucosal fibroid, that Excessa is the best option. Myomectomy would be a better option for her. I got a 28, 29-year-old woman with a submucosal fibroid, and has some time to play with. Excessa makes a little bit more sense. But again, it all depends on what you want, what your symptoms are, and what, what sounds the best for you, what fits your life, because, realize that, certain procedures, you may or may not have symptoms still, right? So are you willing to wait for Excessa to work for a few months? If you have time and you have patience, absolutely. If you want things done right now and you are an immediate type person or what have you, and want the fibroids gone absolutely right now, I don't want to hear nothing else, then myomectomy makes more sense. So it's no real true answer to that. I say case by case basis, but I will tell you, I am not a proponent, or I am not in agreement with UFEs. I don't take away the option from anybody because I don't think that's my job. My job is to give you every option. I will tell you that it's my opinion, but I will give it to you as an option. I just don't, I don't push anybody to go get it because I don't personally agree with them.
Is getting a hysterectomy the only way in which to deal with
adenomyosis? Yep. So, yes and no. So, hysterectomy is the only way to definitively treat adenomyosis, meaning that get to actually be done with it, right? If you get a hysterectomy, adenomyosis is gone. The pain, the bleeding, and everything associated with adenomyosis is gone. But there are other treatments for adenomyosis. They actually, UFEs, it is indicated, or it is an option for adenomyosis. That might be one of the only few things that I would say as a last ditch effort for adenomyosis would actually be, an option for adenomyosis. There are medications to help with the pain and the bleeding from adenomyosis. Most people, it really kind of depends on what it is. Some women are having pain from the bleeding aspect. So if you can fix the bleeding, even though they have adenomyosis, the pain is improved because their bleeding isn't. So, there are medications, there's endometrial ablations. There are also, there are things that can help alleviate the symptoms of it. But to truly treat adenomyosis, and adenomyosis, for everybody that doesn't know, like, what the hell is that? Adenomyosis is when the lining of the uterus actually grows into the muscle of the uterus, right? Endometriosis is when the lining of the uterus grows into the pelvis or into the inside of the belly of the uterus. Adenomyosis is just when that lining actually grows into the muscle. It is very painful. It can be very painful. It's not painful for everybody, but it can be very painful. It can cause infertility and it can cause excessive bleeding.
Why do women of color seem to be more prone to having fibroids?
So we don't know the true answer to that. I can give you my opinion of why I think it's that way. But when we say more, it's 80%. So 80% of all Black women have fibroids. Now, people like, oh my God, everybody. But with that being said, understand that fibroids are not always bad. So a large majority of women have fibroids and don't have problems. They don't have excessive bleeding. They don't have pain or what have you. So for those women, you don't have to do anything. Fibroids are not going to kill you 99.9% of the time. But if they're not bothering you, you leave them alone. But for the subset of women that have fibroids and are causing them these issues, then yes, you do need to treat them. But 70% of white women have fibroids too. So 70%, 7 out of 10 white women, 8 out of 10 Black women. So yes, there is an increase. It's not a huge significant increase, but yes, there is an increase. My only rational thought that I can really think about that of why women, Black women have them is just because we just really did more work, like had more babies, were much more active, like during slavery and during all those times. So it's just really kind of like a natural selection, if you will, of where fibroids grow. Fibroids are benign smooth muscles. We don't know benign growth of smooth muscles. We don't know exactly why they're there, but I look at it like this: they're like calluses of the uterus, right? So if you overuse anything, like when you lift, you have calluses on your hand, like when you lift weights. Well, the uterus is consistently moving, it's consistently cramping during your menstrual cycle. It's growing during pregnancy. You have to push to get the baby out. It's consistently dynamically moving. So it's almost like a callus, if you will, or an abnormal growth of this muscle that's continuously moving. Again, you're not going to find that in the textbook. This is me just after years of really thinking about it and nobody coming up with an answer, how I rationalize it, how I think about it. But that's the only logistical answer that I can come up with. Nobody else can, like, they don't even have just anything out there, but that's just what I thought about. That's what I think.
Are there ways to unblock your fallopian tubes?
Hey, all right. No, and well, I won't say no. Let me not say that. I will say this. So when fallopian tubes are blocked, there's typically a fluid in the fallopian tubes, and that condition is called hydrosalpinx, right? So hydrosalpinx is a huge impediment to fertility, right? It causes people to be infertile. That's not only because the sperm can't get through, but a fertilized egg can't get back to the uterus. So with that being said, that fluid within the tube is what's called embryotoxic, meaning that fluid can spill into the uterus and kill a newfound embryo. It makes pregnancy difficult, and it also increases the risk of ectopic pregnancy or pregnancy that's outside of the uterus. It increases those things. I will say this: Are there surgeries in which you could perform on fallopian tubes, or that can actually reconnect if they've been a tubal performed, or to help unblock drainage? Yes. Are those surgeries or procedures very successful? No, they're not. Right. So the success rate of a tubal reversal is like 15%. Right. So if you went to a reproductive endocrinologist who really, they make their money off of their success rates, right? They have to put their success rates in a database. So you're not going to find a reproductive endocrinologist or a fertility doctor that's going to offer you a tubal reversal or a surgery on your tubes, because their money depends on it, right? Their name, their reputation depends on it. So if you have that, I would not expend resources into doing that. Like I would not expend resources into trying to correct tubes, because the success rate is low, the surgery is extensive, and it's just not something that is very fruitful. When you do surgeries and you do things, you want to be very direct and you want to give yourself the highest opportunity to achieve whatever you're trying to achieve. So if you're trying to get pregnant, why would you deal with something that's going to be 15% a 15% success rate to try to get pregnant, as opposed to something that's going to be much, much more fruitful. All right. So if you have blocked tubes, or if you have, issues with your tubes, the more fruitful thing is to remove the tubes and to actually do something else, as far as whether it be in vitro fertilization. You can do, you can get surrogates, meaning you can have your eggs retrieved, mix them in with your partner's sperm, and have someone else carry them if your uterus has a problem, or mix them with somebody else's sperm and put them into your own uterus. But trying to play the game of getting back and forth with these tubes is just not a game that you really, really want to play. Can it work? It most absolutely can work, but it's just not very high yield, meaning your success rates are low.
All right, so doctor, tell people where you at, because I get people that are trying to visit Atlanta to see you, or they telling me that they looked you up in California, and I'm like, we don't live in that state.
Very much.
So tell people where you at.
So you see me in these places because, like, I'm actually going to, like, I two companies, Hologic, Intuitive Surgical, robotic surgery, as well as Accessa. Like, I go teach these surgeries. So that's why when I post all of these cities or what have you, I'm there teaching those surgeries. I am in Chicago. I am in my office is in Hazel Crest. I have an office in Chicago. I operate at University of Chicago Ingalls. This is in Harvey, which is like south suburbs of Chicago. That's where I'm at. People will reach out to me all the time and be like, I wish you were here. I wish you were there. And my answer to that is this, right? If you are in a place that's not offering you the surgery, like if you have, for whatever reason, you don't have, any doctors that look like you, or any doctors that, whether they look like you or not, don't care about what your health is, or they're not giving you your options, you gotta travel, right? So, like, I've never heard a woman yet say, man, I ain't going down to Miami to get my butt. It's too far. I ain't getting my tummy tucked. I ain't getting that. Like, you hopping on a plane going there getting fat sucked out. Or, women going to Colombia, women going to DR, whatever, to get all of these cosmetic surgeries, but you won't travel to go and get, the surgery you actually need for, your health. And I'm not plugging myself, because there are other doctors or what have you. If you are close to Atlanta, there's, Dr. Hawkins is in Atlanta. You in Louisiana, Dr. Simeon is in Louisiana. Like, there are doctors like that are in these places that you have to maybe travel outside of your comfort zone. But if that means that you don't have, I swear to goodness, I had a patient that hurt my heart. It hurt me to the core. This woman poor woman had a vertical incision. I have never seen this to this day. This is the first time I've seen it. She had a vertical incision from her pubic symphysis, which is the bone like at the top of her vagina, all the way to her xiphoid, which is like right up underneath her breastplate. Like, literally an incision as long as my arm, all the way down, for fibroids, right? If you have doctors that are doing things like this, you have to travel. We're not in abundance. Black doctors are not in abundance. We are, kind of not rare, but we're not in abundance, but they're here. And you may have to travel. You may have to be inconvenienced. You may have to switch your insurance. You may even have to come out of pocket for some stuff. But if that means that you get a surgery or a treatment that is going to be ideal for you, do it. Invest in yourself. Who else you going to invest in? Like, invest in yourself. I know I'm going to invest in myself. Like, you can't complain about, care if you're not willing to put the investment into yourself and making sure you get what you need.
And I'm glad you said that, because that's one of the reasons I really wanted to share my journey too, because when I was doing investigation or trying to hear other women's stories, you may hear if women have conversations with each other, their experience with a hysterectomy, but all the videos on YouTube were mostly women, what they went through for cosmetic procedures. It was like maybe one person that talked about a journey after a hysterectomy, or like you said, the surgeries you really need, or, something that, not saying people don't need electives, but I'm just saying, like, this was a health thing for me. Like you just described what happens with anemia, all the heavy, but it was literally hard to find women talking about that journey. I mean, I did ask you some questions that people ask plastic surgeons, because it was surgery, but it was really hard to find people talking about that type of journey. So that was one of the reasons I really was glad to partner with you to do some of this or share some of this. And you're right. I get women that send me pictures, DMs. They talk about horror stories, things that happen. But overall, I want to say that almost every woman that has reached out to me has said that the hysterectomy, if they were done having kids like me, was still the best choice they ever made. Like nobody usually regrets it.
I haven't heard a regret yet. It's like, it's to be done with periods. And I mean, and that's only if you, and because people are also told you like, he out here trying to snatch women uteruses. I am not.
Sterilized.
Keep your uterus, mama. I promise you, I am not out here trying to snatch nothing. Like I that's not my aim. My aim is to, help. Like to be like literally like I posted all of these things where if you look at our history, women have been brutalized. Like the only reason these surgeries are even in existence because Black women have been used as guinea pigs for centuries.
Yes.
All of like it's without anesthesia, like horrible, hold down, cut you open, leave them debilitated, dying on the table surgeries that Black women have been through to get to the technology we have now. So there's absolutely no way, shape, and form with our ancestors going through this stuff that we should not be afforded the technology that's been built on their backs. That's crazy, right? So, with that being said, I totally understand that. I totally am sympathetic to it. I totally get it. And I am not ever trying to push any type of surgery on anybody. I only do what is necessary and what you want. Now, what I am, I do, and I tell people all the time is you have to be realistic, right? You have to be realistic. You have to have a plan. Whatever that plan is your plan. If you have a plan, I'm all for your plan. But you can't come in here like at 44 and having fibroids as big as all outdoors and bleeding and done having babies, got your tubes tied and everything else, and be like, I don't want no hysterectomy. I just anything to just keep my uterus. For what? For what, mama? For what? What we doing with it? You trying to get a trophy, donate it to the Smithsonian? Like, what you trying to do with it? Like, don't sit up there and suffer if you don't have a plan. But if you're 44 years old, you got these big fibroids, you ain't never had a baby, you still got good eggs, like, by all means, let's do a myomectomy. Let's go for it. Let's set up a plan to get you to a reproductive specialist after it, get that whole ball rolling. Let's do it if that's what you want to do. But have a plan. Don't just not do something because you heard it was bad or what have you. Educate yourself on it and find out, what makes sense for your life. Another question was, can you have pain after partial hysterectomy on the side that the ovary is still there? Yes, you have ovaries that are there. You're not having pain from the hysterectomy. If your ovaries are there, your ovaries are still active, right? So if you are premenopausal, right, your ovaries don't stop. You don't stop ovulating. You don't stop producing hormone just because you don't have. For you to go to the doctor after. If you're keeping your ovaries, you need to make sure that them ovaries are okay. Yeah, they can still have cysts. You can still develop cancers. Those things can still happen if you keep your ovaries after a hysterectomy.
I definitely still had cravings the time that I would have got my cycle. So they must still work because I had cravings, I had tender breasts, but I just don't have any bleeding.
That is.
And I love it.
How do you get a consult? Just DM me. I'll give you all the information. If you're local, I'll give you my office number. If you're not local, I'll give you my website, and we can set aside time to do consultation.
That was going to be next. I was going to say, how can people get in touch with you if they want to visit you?
Yeah, if you local, I would have you just come see me in person. You don't necessarily need to set up a video conference. That number is on my website, but it's 312-929-9191. And if you're not local, just scheduling time on my website just to schedule it is docforthestreets.com. But that's on my website stuff too. If you got any questions about that, just DM me. I'll send you that information. And that's too. It was like somebody sent me a DM and was like, give me this whole long paragraph about like my daughter has all the, these fibroids, she's this, that, and the third, going through these things or what have you. And I was like, hold up. I'll send them in a minute. I was like, look, just set up time for consultation with me. I will go through her history or whatever. And she, like, her comment was like, said something like, well, she doesn't live there. Like, consultation is not going to help. What is a consultation going to do? And I'm just like, all right, well, that means you just don't want me to help you. Like, I don't know what you want me to do. Like, I can't see you. And if I'm